Hi everyone. On the occasion of Doctors' Day celebrated in India on the 1st of July every year, warm greetings from the Spine Foundation. Spine Foundation, as you all know, is a group of orthopedic spine surgeons practicing across the country and abroad who at no time lost an opportunity to give back to society at large. Ever since its inception, which is by Dr. Shekhar Bhojraj, a renowned spine surgeon of repute, all of us have joined him in the endeavor at different stages, different periods, and in different capacities to go back and provide comprehensive spine healthcare to the underprivileged in our society, especially the ones who have no access to quality healthcare. This is me, Dr. Raghu Prasad Verma, the present president of Spine Foundation, welcoming you all.
So, Doctor, when and how were you appointed as the president of the Spine Foundation?
So somewhere I think somewhere around COVID times in the years of 2021, but when most of us were indoors, was a time that the members of the Spine Foundation, along with the consent of the trustees of Spine Foundation, and on the recommendation of our mentor, past president and present chairperson, Dr. Shekhar Bhojraj, that I was asked to join and be appointed as the president of Spine Foundation. It's an honor and privilege to be a part of it.
Can you share with us some of the challenges you faced as a president in leading the Spine Foundation?
So, as I said, I took charge, if I might call it, during COVID times. COVID itself was a problem because we used to have these extensive weekend travel to multiple areas in the interior of Maharashtra and otherwise, where we used to conduct camps, both OPD and outpatient and surgical camps. That had completely come to a stop because we couldn't travel. But I guess you get an opportunity from an adversity, and that's where the world was turning online. So we decided, why don't we use the same facility? So we started conducting online camps, OPD camps, where the local authorities would collect a group of patients, and one of us would actually attend to those patients and provide with care, though we were not physically present there. The second challenge, if I might say, is the fact that we wanted to introspect this during this period of why certain centers of ours where we provided care were failing and not standing up to our expectations. Whether it is because the intent wasn't there, or probably the intention and the interest wasn't there, or whether the infrastructure was failing. We were very keen to learn where we were going wrong in certain centers. Continuing with introspection, there are two things more that was a challenge for us. One, we were a very service oriented organization. And because we were in it, we were all the time focusing on getting good results, what we believed were good. But we wanted a certain outcome analysis looked at by a third party who was away from our Spine Foundation activity, which is very important. And more so, we had to justify the cost effectiveness of what we were doing. Um, because the donations that came into the Spine Foundation from Good Samaritans had to be justified. These were our challenges at that point of time.
What is your vision as a president for the future of the Spine Foundation, and what steps are being taken to achieve that vision?
Yeah, so we bought our vision out of our challenges that were posed in front of us. So I told you that one of the things was to find out what was going wrong. So we realized that the Spine Foundation had to grow both vertically and horizontally. Now, what is horizontal growth for us? Each of our fellows, after their training, would go back to their hometowns and start spine related private practice. But we said that we should have these fellows go out and look around about 250 to 300-kilometer radius as to organizations or local bodies which might help us do Spine Foundation work for the truly needy. So we've sent the message across as to let everybody be on the lookout for such organizations. That's one. The advantage here is that we'll span out into many other states across the country to start off, where we don't have a presence, and use that as our modality in our outreach program. We also wanted to go vertically up and down. Now, what's vertical up for us? We are a very shy organization, And we suddenly realized that most of the activity nowadays happen in the clouds. As we say, internet and social media are up there for everybody's reckoning. And we believe that we should have a place in it so that people know of the quality and the kind of work we do for the rural or urban poor. But vertically can also be down, mind you. We also want to dig deep into what we've done till now and have a very clear introspection of what are the things that can improve from here on. This primarily for me, the growth vertical and horizontal of the organization is my vision for which we've started to take some steps. Now, how did we do this? One, we said that we should have a research group which will look into all the work that's been done till now and look, as I said, at the outcome analysis clinically, which means whether a patient is done in a rural hospital in the country or a corporate hospital in the city, the outcome should be the same because we are not here to do compromised work. Also, we wanted to look at a third party's overview of what we were doing. So we are now constituted an advisory board with some eminent people, mind you, who will kind of stand outside and dispassionately look at what we are doing and how we can improve from here on. I think these are the few things that I feel have to be given priority for the future.
How has the Spine Foundation changed your life as a doctor?
So when I passed out as an orthopedic surgeon, I had multiple subspecialties to look forward to. But mind you, I joined the Spine Foundation unit incidentally, but the work ethic in the unit, along with the fact that we were trained well to properly diagnose and execute treatment protocols to our patients with proper follow-ups, was a way in which I was enriched more as a spine surgeon. This was peppered well with involvement in academics. But what made me feel much better as a doctor is the ability to empathize with all my patients with excellent bedside manners, provide and alleviate their pain and disability. But mind you, do all this irrespective of their socioeconomic status and give a helping hand, especially to the underprivileged in our society. That has made me a definitely better human being than I was. And mind you, you have to be a good human being to be a good doctor.
Where do you see the Spine Foundation in the next 1 year?
So, as I enlisted our vision for the future, I think the next 1 year is going to be crucial because it's a big step and a change over time for the Spine Foundation. We want to believe that the advisory board would meet in a short while because the agenda is being set, and therefore we have a roadmap for the future, and that should be done in the next 1 year. The second thing also is our recent two fellows who are going to now pass out after training and go back to your hometowns to start work will be enlisted or entrusted with the job of looking for these local centers that we discussed about wherein Spine Foundation work can kickstart. So we are broadening and growing horizontally. And not last but not the least, I think the research work is going in good pace, and we want to believe that we'll have a few publications ready, which will help us to provide for literature in the field of rural spine surgery and provide ourselves an opportunity to give back to the medical fraternity itself as a whole.
How do you approach the delicate balance between conservative treatments and surgical interventions?
Yeah, so when we are trained in the Spine Foundation, there are four pillars on which our training is based. Conservatism is the essence because we believe strongly that 80% of the problems in spine can be handled by conservative, non surgical, non interventional mechanisms in which physiotherapy or rehab has a lot of role. The second is we believe in, without a doubt, simplistic techniques when it comes to surgery with proper execution and a very important proper follow up. With the execution being good, use of simple techniques which are reproducible and a proper follow up, we learn from our own patients. In this, so many years of our experience in the foundation, because of our conservatism, we have got away with extremely good results in our patients in broad spectrum of people that we've seen both in rural and urban poor. I think the best way to answer this question is we believe in Spine Foundation. When you see a patient, ask yourself, what would you do if the patient was you? And I think that gives the answer straight away.
How do you manage patient anxiety or fear related to spinal surgeries?
So, spine surgery is a niche branch, and it's but natural that most patients would have some amount of fear. The fear can be of two things. One is the unknown because they have never experienced it and they don't know what they are going into, or two, of something that has happened bad in the past, experiences either heard of or actually felt within the family or the neighborhood. Most times, this is because there has not been preoperative counseling of the possibility of this happening, because it comes as a rude shock postoperatively if something goes wrong. So, I think quality time spent in counseling the patient, speaking to them of the pros and cons of the procedure that's going to be conducted, and probably most importantly, giving them a realistic expectation out of what we are going to do makes it easy. All complications postoperatively are handled both physically and mentally well by the patient and relatives if they are aware of the possibility. Do not promise the moon when you can't just about make it to the rooftop.
In what way do you think you would want to give back to the society?
So, back pain, which obviously most times have a spinal cause to it, is one of the most non communicable common diseases in the world. Being a doctor, actually, it is pretty easy for us to be giving back to society at large. And what more can be more enriching as an experience if we can alleviate pain and disability and improve the quality of life of patients around the spectrum of the society, irrespective of the socioeconomic status of theirs. So, here's wishing all our brethren in the medical fraternity a very happy Doctor's Day from all of us in the Spine Foundation. Thank you.